of the patients there. Welcome, Ms. Nancy.
Good morning, ladies and gentlemen. My name is Nancy Chen. It's my honor to appear before you today on behalf of Dr. Xiao. I'd like to welcome you to our presentation on the study of the topic, Risk of Sudden Sensorineural Hearing Loss in Stroke Patients, a 5-year national investigation. Sudden sensorineural hearing loss is defined as a hearing decline of at least 30 decibel over at least 3 test frequencies within 3 days. It is considered an otology emergency. In most cases are idiopathic. The etiology of sudden sensorineural hearing loss has only been identified in 10% of the cases, in which stroke is one of the most common causes. Stroke is a leading cause of acquired disability in adults. Neurological and physical disability are often long-term. Rehab in these cases is a crucial phase toward recovery. However, post-stroke hearing loss could greatly impede the rehab process. And it has been found that hearing loss might increase the risk in mortality to mediating variables. Previous population-based study has found that sudden sensorineural hearing loss is correlated with an increased risk of stroke. However, the reverse relationship has not been investigated. To gain a deeper understanding of this crucial question, our study aims to evaluate the development of sudden sensorineural hearing loss after stroke, as well as to investigate the interrelationship between post-stroke sudden hearing loss and the clinical profile of stroke patients. All data used in this study were retrieved from National Health Insurance in Taiwan. NHI in short is a mandatory insurance program that covers more than 99% of the residents in Taiwan. The high accuracy of its data has empowered hundreds of peer-reviewed studies. This is a retrospective cohort study in which we used a large-scale population-based data to analyze the occurrence of sudden sensorineural hearing loss in a cohort of patients. The cohort was composed of a stroke subgroup and a non-stroke subgroup. In the stroke subgroup, we included patients who had been newly diagnosed with any type of stroke between 1997 to 2005. To ensure the accuracy of the data, only patients with at least 2 outpatient visits or at least 1 inpatient visit for stroke were included. In a non-stroke group, 3 patients without history of stroke were randomly matched to 1 patient in the stroke group based on the corresponding age, sex, and index year. Patients with pre-existing diagnosis for stroke or sudden sensorineural hearing loss were excluded from both cohorts. We also excluded patients under the age of 18. The outcome variables was based on the occurrence of sudden sensorineural hearing loss in the 5-year period. The diagnosis code of sudden sensorineural hearing loss had to be assigned by an otolaryngologist. Also, only patients with at least 2 outpatient visits or at least 1 inpatient visit for sudden sensorineural hearing loss were included. A total of 44,460 patients were included in this study. This table shows the demographic and comorbid profile of the participants. Stroke patients were more likely to have comorbidities such as hypertension, hyperlipidemia, and diabetes than non-stroke patients. We also found differences in urbanization level and monthly incomes between the 2 groups. All these potential confounders were to be included in regression models. During the 5-year follow-up, we found that a total of 171 patients developed sudden sensorineural hearing loss, including 66 patients in the stroke group and 105 patients in the non-stroke group. The overall incidence rate was about 2 times higher in the stroke group than in the non-stroke group. And a higher incidence rate in stroke patients occurred regardless of age, sex, and follow-up period. This figure demonstrated sudden sensorineural hearing loss free rate between stroke and non-stroke patients. In a 5-year follow-up period, stroke patients presented a lower sudden sensorineural hearing loss free probability when compared with non-stroke patients. After adjusting for potential confounders, we found that stroke patients were 1.71 times more likely to develop sudden sensorineural hearing loss than patients without stroke. We also evaluated whether the risk of sudden sensorineural hearing loss in stroke patients were affected by the type of stroke. Compared with non-stroke patients, those with ischemic stroke presented a greater risk of sudden sensorineural hearing loss. And hemorrhagic stroke was not significantly associated with increasing risk of sudden hearing loss. As demonstrated in this figure, sudden hearing loss free probability was significantly lower in ischemic stroke patients compared with hemorrhagic stroke patients and non-stroke patients. Interestingly, patients with hemorrhagic stroke presented a higher but non-significant sudden hearing loss free probability than patients without stroke. Theoretically, both types of stroke could affect the auditory pathway, and previous reports of central hemorrhage have also documented auditory dysfunction in patients. Further research will be required to clarify our findings and to explain how stroke subtypes affect the risk of sudden sensorineural hearing loss. To determine whether stroke is a time-dependent risk factor for sudden sensorineural hearing loss, patients were divided into 3 subgroups according to the duration of follow-up of 1 year, 3 years, and 5 years. In all 3 follow-up periods, stroke patients presented a significantly higher risk of sudden sensorineural hearing loss than non-stroke patients. Notably, the highest hazard ratio was observed in stroke patients with a follow-up period for 1 year. We investigated whether stroke is an age or gender-dependent risk factor for sudden hearing loss. Our result revealed that stroke patients aged 40 to 59 presented more than 2 times higher risk of developing sudden sensorineural hearing loss than non-stroke patients in the same age group. Stroke patients of either gender presented a higher risk of sudden hearing loss than non-stroke patients of the corresponding gender. This is the first study to identify a link between stroke and subsequent sudden sensorineural hearing loss. Physicians should be mindful of possible subsequent hearing problems among stroke patients. Given the strong likelihood of stroke as a predictor for the development of sudden sensorineural hearing loss, early recognition of hearing problem is indicated as part of a broader cerebrovascular event. A failure to account for post-stroke hearing loss could impose a negative impact on recovery. Hearing status should be carefully monitored among stroke patients. Through early detection, clinicians could offer a timely management to preserve patients' hearing. Thank you very much.